From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Well, today we are talking about summertime bites, summertime rashes. We all get them, and Dr. Allen Cockerell joins us today from Sherwood Family Medical Center. Welcome to the show.
Thank you so much for having me. I appreciate it.
First time on, and you now work with our Dr. Laura.
That's correct.
Yes.
Yeah, Dr. Wilson and I are now partners, so looking forward to getting started with the Sherwood Clinic there.
Well, good. We're going to talk today about something, we all know about, but we need to learn how to treat them. Summertime
Absolutely.
bites, insects, rashes, the whole thing. And we see a lot of this, don't we?
Sure, yeah, we sure do. We see it a lot in clinic, and I'm hoping, the list of bites and rashes is quite long, right? So this is not going to be an exhaustive study or a talk today, but I'm hoping to hit some high points, some practical things that people can really take home and use in terms of tips and pointers for the bites and rashes.
Okay, very good. So bug bites, we all get them, we know what they look like, but sometimes they can get infected, right? What does that look like?
Sure. So one thing to point out first is what's not infected, because the vast majority are not going to be of a medical concern anyway, maybe concerning to you, but not, to us as physicians. So a lot of times you get a bite, they get a little red, a little itchy, they go away without any issue, right? That's not really what we're talking about. What I wanted to kind of discuss was a diagnosis of cellulitis, and that's the medical terminology for a skin infection, right? So cellulitis has a few cardinal features, and I think they're going to be listed on your screen in just a second if they're not already, but those would include redness and swelling and warmth and pain to the area. So all of those things are things to look for in terms of an infection being present.
Okay, more than just your average mosquito bite.
Correct.
There. Okay, so when should we go see a doctor if we're seeing some of that?
Sure. I think if any of those things I just mentioned are abnormal for you, meaning, we like you said, we've all had bug bites in the past. If it looks abnormal to you, if it looks like it's more red, more swollen than usual, get that checked out. The other thing I tell patients too is if it's worsening and worsening quickly, that is something to definitely check out. So say you get bit, day one, not a big deal. Day two, you look down, the redness and the swelling is quite large, or much larger than what it was before. Get that looked at as well, because there's likely some infectious problem causing that rapid spread. Okay,
so if we come to our doctor then, would we likely get antibiotics, and can that help?
For cellulitis, yes. So it's a treatable condition, and we'll talk about that in a second, I think. But there are medications out there that we use to treat this, and we try to use by mouth antibiotics as well. Depending on your drug allergies and some of your medical history, your doctor can choose what's best for you. But lots of good options, yes. The thing I wanted to catch here is to say that, if cellulitis goes untreated, goes unchecked for a while, sometimes we're unable to use by mouth antibiotics. Got to put you in the hospital, do some IV medications, things like that. So if you have a concerning lesion, please get it checked out early. Reason being, we want to treat with by-mouth antibiotics if we can, and avoid hospitalization.
Earlier is better if you're in doubt about it. Okay, let's switch and talk about rashes. And what are we talking about here?
Yeah, so again, the list of rashes is incredibly long. I wanted to touch on two common types of rashes that we see this time of year. And these are very common. One is a contact rash. Or contact dermatitis is what we call it in the medical field, and the other is fungal type rashes. Okay,
so let's go over those. Is contact like poison ivy or that kind of thing, which I've had and you don't want?
Me too, yes. I think we've all had poison ivy, sumac, something like that at some point, right? So a contact rash is very simple, yes. It is literally a contact with something that's offensive to your skin. So all those rashes that we just mentioned, there's a list of others, but yes, those are the contact type rashes where you physically come in contact with something.
Right, okay.
The fungal type rashes, the second thing I wanted to talk about, those are a little bit different in how they present, and we'll talk about that in a second, but those are the main ones that I wanted to discuss.
Okay, let's talk about what a fungus or a fungal rash is.
Sure, so fungal rashes typically occur in the intertriginous areas. So those are areas of the body that really trap moisture and heat. When we think about those areas, we're looking at the armpits, the groin, any skin folds that may be present.
Right.
And they do have a distinct look. They look much different from, a contact rash or something like that. But yeah, they primarily occur in those kind of heat trapping areas.
Is that just like moisture, humidity, sweat, that kind of stuff?
So why this is applicable to summertime, we definitely see an increased frequency in those just because of the atmosphere outside.
And then how do you treat those the same way?
Those are actually treated differently. So there's usually we try to do some topical ointments for the fungal type rashes. But yeah, if it's bad enough, we do orals, but there's a little bit treatment difference between the two.
Okay, and then you want to touch on diabetics because they have some special concerns when it comes to
Sure.
rashes or bites.
Right, and I wanted to pull up a few points just in terms of, letting the viewers out there, know what we're looking for and what we would suggest in terms of rash treatment, things like that. And I think you'll see them on your screen here. But the first thing is, steroid creams, over-the-counter hydrocortisone, those type of things. They do work, they do have their place, right? But not always effective, and sometimes they can worsen a rash, especially those fungal type rashes.
Right, okay.
In terms of trying to, avoid the rashes in the first place, common sense. For the contact rashes, just be aware of what you're touching. Be aware of what you're coming in contact with, know your surroundings, I guess. That's not hard to understand. The second thing I wanted to mention for the fungal type rashes, they made it a little less intuitive, but wear loose, airy clothes.
Okay.
So we talked about heat trapping and moisture. When you're wearing tight compression type clothes, it just makes those issues worse.
Okay.
So if you're a guy, for example, rather than compression shorts, wear boxers. Something that's going to breathe a lot more.
Okay.
And then to your point about diabetics, yes, I wanted to touch on this too. If you're diabetic out there, if you're immunocompromised in any way, you're at an increased risk for getting a fungal type rash.
Okay, so just watch it. If it looks funny, if it looks redder to you the next day, go see your doctor. There's so much you can do to help us.
Absolutely, yeah.
Okay. We want to put up the information about Sherwood Family Medical Center. I know you're one of the new guys there,
Yes,
so I know
yes.
they are happy to have you, and
Happy to
we
be
are
here.
happy to have you on the show today, so we appreciate it. There's the information on your screen. If you have any questions or some other health concerns, you can always give them a call. We appreciate you.
Thank you so much.